My name is Justin Gill. I am a family nurse practitioner, and I currently reside in Northwest Washington and care for patients here in my local community. So COVID-19 hit the Pacific Northwest first in the United States. And I currently work in a clinic's health system that dealt with the first COVID positive patient, as well as the first cases of community transmission, both within the state and in the country. This presented a lot of challenges for myself, as well as many of my other nursing colleagues. It also presented a lot of challenges, uncertainty, and concerns among the patient population in the state. It was a rapidly changing environment. There were changes in PPE recommendations, testing protocols, and changes in society as a whole. Changes came every other hour to every other day. I can recall in that first week when we saw the first case, as well as the first cases of community transmission, how the recommendations for mask use changed 3 times in that single day. There were differences in the CDC recommendations, the World Health Organization, and the OSHA organization for how healthcare workers could best prepare themselves and protect themselves in the workplace setting. There were also changes in what our leaders were conveying to the members of our society, as well as to healthcare workers. There was uncertainty in our clinical practice. We were uncertain about how we actually go about educating the public, how we treat the illness, what changes we needed to make right away, and what changes we needed to make long-term in order to prevent the spread of the illness. I can recall in my first few weeks dealing with COVID-19, seeing the concern among basis, but I also saw the concern that I saw among my fellow nursing colleagues. We ourselves were dealing with something that was so novel, and we were very, very uncertain about how we would move forward. We didn't know what the future would look like. We did not know what the next 2 weeks would look like. So hopefully, as the rest of this nation is dealing with their outbreaks and Washington State continues to work through their outbreak here locally, I can provide you with some tips that can enable you to take control of the situation in your own clinical setting and facilitate change moving forward. So as you can see in this graph from the Public Health Department, from the Washington State Department of Health, our cases increased rapidly. And we had this plateau that continued to go down, but we still see sudden spikes in cases. We are on the downslope, and various counties are moving from phase 1 to phase 2, and in some cases, phase 2 to phase 3. But this graph shows that we are not out of the woods yet. And our state, like many other states, continues to deal with the crisis on a day-to-day basis, and we need to continue to be prepared. So I want to give you a few key takeaways that you as a nursing leader in your clinical environment can facilitate change and tackle this pandemic head on. One of the key components is remembering those nursing fundamentals. I honestly look back at my nursing education and I can say that nursing fundamentals was not necessarily my favorite course in nursing school. But now I see why it was so important, why we learned about Florence Nightingale, and in her time, how she facilitated infection prevention and health promotion. The basics of providing a clean environment for patients, making sure that their other healthcare needs were met, giving them clean food, access to water, a healthy environment, and clean air. Those were key components to making sure that patients were able to, one, not get ill, but also if they were ill, had better outcomes. Our focuses on health promotion and illness prevention are key components of nursing practice. We are the experts here. We are the ones that educate patients and deal with them on the front lines. We are the ones that deal with them on our 12-hour shifts. So we are best positioned to make changes and to focus on infection prevention and health promotion. We also need to recognize our presence in the public arena. Nursing is the most trusted profession in the United States, And we need to leverage that so that we can better care for our patients and advocate for them in addition to ourselves. We have an obligation ethically to speak up in both public and clinical venues. In the public setting, we need to speak with our lawmakers. We need to speak with our local public health officials and let them know what changes need to be made. This can be done in a town hall setting. It can be done virtually. It can be done through writing letters and engaging on social media. I had the fortunate opportunity of doing a webinar with Governor Jay Inslee as part of his press conference on Nurses Day to talk about my experience and why we as a society and a state needed to move forward with caution and some sense of optimism. We need to educate the public about what it is, the threat that we face. Although we in many states are going in a downward slope, we need to focus on how we continue to keep up the pressure on COVID-19. We need to continue practicing social distancing, but not also say that we need to practice it, but explain why it is that effective for preventing infection. These basic key components of nursing practice that we learned from our first days in nursing school are, if anything, more important now than ever. This is not going to be the last pandemic that we face. But if we can hold these key components of nursing practice in place throughout each of these crises, our society will be better off for it.